Assalamu alaikum, my dear sisters, and good afternoon to all. And this is going to be a very valuable and very exciting session. I have with me somebody who has joined from Bangalore, India, and this is for the GCC women community that we are bringing this. We have Dr. Manjunath with us. So, welcome, Dr. Manjunath. I request you to please just share about yourself and your work, and then I'll be really having some set of questions for you. Over to you.
Thank thank you, Dr. Nahid Khan. And it's my great pleasure to be here and addressing all the lovely women there. Myself, Dr. Manjunath Swami. I'm basically a gynecologist with experience of 20 years and more into infertility and gynec laparoscopic surgery, where I treat lot of gynec problems. So, having said this, we have a chain of infertility. It's called as Birla Baby Science. So, which was almost 50 centers across India, where I'm a deputy medical director for the entire group. This is my background.
Yeah, thank you so much. We have an expert with us, and surely I want to make everyone very comfortable that you can write, comment your questions. Even you can do for the people who are watching this recording after this podcast. Thereafter, also, you can have your questions. Our team would be attending to it. And for the people who are interested, we would certainly like to work with them very closely. So, Dr. Manjunath, actually, I want to understand as a layman, like what PCOD and like what is this? How can this can be explained in
Yeah.
very easy terms?
Fine. Uh, People often comes with like very confusing fear or idea about the PCOS or a PCOD. I will in later on I will explain what is the difference between PCOS and the PCOD. Basically, you need to understand in PCOS or PCOD there is a metabolic disturbances which will lead to hyperinsulinemia, means there is excessive insulin secretions it's happening, and hyperandrogenism means there is excessive androgen hormones. You all know that human has male hormones and the female hormones. The male hormones are called androgens. Female hormones are basically estrogen and progesterones. But nothing to do with that. Male hormones should not have in the female, or female hormones should not be there in the men. It will be in both men, both male and female hormones will be there. In female, both male and female hormones will be there. But when the proportion changes, then the problem arises. So even in women, there are male hormones. Those are called androgens. So in PCOS, androgens will be excessive. So one, there will be insulin secretions will be more, then androgen secretions is excess will be there. Plus they will not have a proper ovulation. Plus there will be obesity, hyper hirsutism means excessive body hair in female. So these are all the characteristics of polycystic ovarian disease. Further, in that, some people will have more complications, some people will not have complications. So this is a varied spectrum of PCOS. Why this happens? That's the commonest thing people ask, like why I have got PCOS. Is this PCOS is very danger to our health? So these are all the questions people will have. So PCOS is a polygenic disease. Polygenic means multiple genes are involved. Polygenic, multiple genes are involved. So basically, all these genes are slightly abnormal. So because of that, the entire glucose metabolism, lipid metabolism, androgen metabolism, everything get disturbed. So because of that, we will see changes from head to toe. So there will be some neuroendocrine disturbances, cardiac disturbances, metabolic disturbances, even gut bacteria, what we call as good bacteria, that also will get changes in PCOS. So it will basically it hampers or it will affect each and every system of the body because it involves the metabolism. Each cell in our body has metabolism, right? So that metabolism is disturbed. So it will affect each system. So that to some people it will affect one or two system, to some people it will can affect multiple systems. So it varies. Plus, as I told, it's a polygenic. It's also affected by epigenetics. Epigenetic means you need to understand that there will be gene abnormality, but that gene abnormality need not manifest. It will manifest only if it is exposed to certain kind of environment. So that is called epigenetics. So don't misunderstand that all gene abnormalities are expressed, means all gene abnormalities are manifested. No, only they get manifested if there are environmental changes to it. So it's a polygenic and epigenetic complex metabolic disorder, I would say, in a simple terms, to describe what is PCOS or PCOD.
So what I've understood is I can say it is like an hormonal imbalance or some hormonal crisis the woman is
Correct.
undergoing.
Correct.
So why is that this so become it has become so common nowadays? We are
Correct.
hearing it so often.
Correct. So people they ask like why it is so common nowadays. Every at least 20-30% of the girls are affected by this PCOS problems. Is this was not a problem of like 3 decades or 4 decades back. No, I means it's not that genes have not suddenly becoming abnormal. Gene abnormality was there from the beginning, but as I told, it's a epigenetic also. We are now into entering into a such kind of environment where these genes are manifesting. So that's why the things are becoming more and more. So what are these environmental things which helps in manifesting these diseases or this condition is sedentary life. Earlier, you know that people used to do a lot of physical activity. Now most of us will not do the physical activity, so it will manifest. Second, they have highly stressful jobs or highly stressful personal lives, so which will add to it. The third,
True.
the environmental toxins, what we call it as, that toxins may be in the diet, in the air, in the water. To say few example, like we call it as BPA, bisphenol A, which is plastic residues, which is there everywhere in air, water, everywhere you see that BPA, bisphenol A, and also certain insecticides, pesticides, which have entered already into our diet. So those are called as endocrine disturbing substances or endocrine disturbing chemicals, EDC. So those like you know all nowadays there is no food which is not treated with either pesticides or insecticides. So those will enter into our food chain. So that those will enter into our body and start manifesting. So these are all the environmental factors which, as I told, since it's a epigenetic, so when there is a gene abnormality, so that will start manifesting when you are exposed to this kind of environment. It's like stressful life or a sedentary life, or even the smoking will increase the manifestation of PCOS. So these are all the environmental things which will increase or which will put them into a manifested conditions.
So, Dr. Manjunath, I am very curious to understand like why the men, even the men, need to know this, and why we should think about understanding and managing it. Like, how
Yeah,
can we
so
do it?
men need to know for two, three things. One, because this PCOS mainly affects in the fertility, means the baby conceiving process or conditions also. So when the couples are diagnosed, when a couple come to us with the infertility issue, first thing we need to look or we see them in this whether they have a PCOS. The lady has PCOS. So if there is a PCOS, she will not be ovulating every month regularly, and when the couple wants to try for a pregnancy, so they will have a difficulty in conceiving a pregnancy, or sometimes even if they conceive also there is increased chance of miscarriages, abortions. So if they conceive also during the pregnancy, the 9 months of pregnancy, they will have something called as increased sugar abnormalities. So where there is called, that's called as gestational diabetes, means the
Yeah.
diabetes which is appearing only during the pregnancy time. So that's
Mm.
gestational diabetes also more. So being a man, when all these things he should be knowing, and they should take little extra care as a couple, like when they have to ovulate, or whether they need to monitor that ovulation, what are the few drugs they need to use before conceiving a healthy baby if they have
Yeah.
PCOS, so they can optimize their health, and then they can try for a pregnancy. And during the pregnancy also, he has to give that emotional comfort to the lady, because
Mhm.
the PCOS patient also have certain kind of neurological disturbances in them. So that also coming to picture when they are trying to conceive, or during the pregnancy, or after delivery, immediately postpartum period also, there the neurological disturbances are more in case of PCOS. So the men should also understand this PCOS, to treat, means to have that sympathetic attitude towards the wife, the caring attitude towards the wife.
Yeah.
That is one reason why
Mhm.
men should have. The second reason is, the male child who is born to a PCOS ladies also have certain kind of metabolic disorders. Like there is more lipid abnormality, high cholesterol conditions, or there is increased chance of baldness in them, or increased condition of cardiac arrest, cardiac myopathies, cardiac arrest. Those kind of conditions are also affected in a male child who is born to a uncontrolled PCO mothers. Not every child,
Okay.
there is increased risk,
Mhm.
I would say. Maybe if the risk is
Mm.
5% in general population, maybe it will increase to 10 to 15%. So that's why even the men should be aware about this PCOS.
So, sir, I want to ask you that individual level, non-clinically, what are the ways that this can be attended to?
Yeah. So once they are diagnosed with PCOS, Dr. Nahid, uh, they will have a lot of emotional disturbances. Means we can
Mhm.
see a varied spectrum of patient I see. Some people,
Okay.
uh, very mild PCOS, they will be there and they will be so much emotionally disturbed. They will give up the hope and they will
Mhm.
come to us. Other spectrum is they will have severe PCOS. They will not even bother. They will come with some 10 years, 15 years suffering from PCOS, not able to conceive after 10 years, 15 years. That means the spectrum is varied when they will come. So first of all, non-clinical things means, can we do means any treatment without using any medicines? So if they're young, like even teenage girls also will come with PCOS, or a young married ladies also will come, where they are not trying to conceive immediately, but they want some kind of solutions. So for them, basically we advise non-medical treatment. What are those non-medical treatment? First of all, lifestyle modification. If what are those lifestyle modification, they should be basically keep moving, means to say they should be physically active. So I will come to that, what is what kind of physical activity they should be doing. The second
Yeah.
lifestyle modification is they should alter their diet. Again, I will discuss what are the diet modification.
Mhm.
Third thing is, there is any substance abuse they are doing, like either cigarette, tobaccos, those are all will increase the disease manifestation. So first they should stop those kind of things. So these are the three things, the lifestyle modification. If required, some kind of meditation, some kind of stress management, all those things they should first.
Yoga also.
Yoga,
Do you recommend
yes,
yoga?
yoga, pranayama, yeah, guided
Yoga.
meditation, pranayama, yoga, those kind of
Breathing.
things,
Yeah.
which will basically alter their endocrine systems. So that kind of things they should start
Got
doing
it.
it. So coming to the few in detail about physical and diet, physical activity and the diet is, the physical activity, they should not concentrate only on cardiac exercise, means cardiac exercises. They should be both cardiac exercises plus the weight bearing exercises.
Mm.
Basically, isotonic exercises means the muscle building exercises, muscle strengthening exercises also should be included in PCOS. Basically, they have a wrong concept that once I reduce the weight, everything will come into picture. Yes, weight reduction is
Mm.
important, and plus they should also have developed that muscle building exercises. That's a weight bearing exercise also, along with
Oh.
cardiac. So you can plan in such a way that you can have a 20-30 minutes of cardio, another 20-30 minutes of weight bearing exercises. So there should be
Mhm.
a combination of both cardiac and the weight bearing exercises. 4 to 5 days in a week, if you do the physical activities, it's fine. Apart from this routine 1 hour physical activity, they should, if they are sitting prolonged period in the offices like that, people have that habit of sitting for say 6 to 8 hours at a stretch, especially the IT crowd.
Yeah.
That's where the manifestations are more. So I would advise, with every 1 hour sitting, take 5 minutes walk or 10 minutes walk and then come and sit. So that
Yeah.
will increase your circulations, increase your whatever the endocrine things which is mildly disturbed, that will improve with that. So these are the physical activity. And in case if you want, if it is 3 floor 4 floor, please take steps, don't use lift. So that's also again,
Mhm.
it's basically continuously you need to keep moving. So that's
Mhm.
the thing you need to keep in mind. Then coming to the diet part, as I means again, as I told, as much as possible, avoid diet with some kind of adulterations, like all those this thing. We cannot completely avoid those diet, but at least wherever possible, please avoid diet with insecticide, pesticides, and plastic use, those kind of thing. Among per core in the diet is reduce the carbohydrate but not totally cut off the carbohydrate. Never do
Okay.
that. Carbohydrate is
Mhm.
required for your general health, for your consumptions, everything. But maybe proportion wise, reduce the carbohydrate, increase the protein intake. So that's what
Mhm.
you need to do in the diet. So every meal, reduce the carbohydrate, increase the protein content, along with so vitamin containing vegetables and fruits is a must. Every diet should have certain kind of vegetables, fruits. And if you are taking a habit of non-veg, you can take, but take lean meat rather than fatty meats kind of thing. So start taking a lean meat proteins, so that is
Mhm.
much better. So a lean meat protein is fish, chicken, even lamb also you can take, but take that as a lean meat, not as a fatty meat kind of things. Those are the things you need to change in your diet. Again, a few people have that dairy products you should avoid,
Mhm.
um, chocolates you need to avoid. Dairy product you cannot totally avoid.
Mhm.
Few things you can avoid in the dairy products, like direct milk consumptions, you can avoid, because sometimes in adult there is something called as lactic intolerance. So if you have
Yeah.
that kind of things, please avoid. So what that will cause, that will disturb the good bacteria in your gut. So that
Mhm.
will again affect the PCOS. So if you have that kind of thing, avoid milk. But other curds, those kind of things is good for your gut bacteria. You can have those curds. So these are all the few things you need to change in the diet.
Okay. Thank you so much. This was really a good insight and so much valuable information, I think, for the
Thank you.
audience. And I encourage people who are watching this to put their like comments. What else is as a query which is coming from them, and even the people who are watching recording. So we would definitely would be happy to reach out to people, because this is actually an initiative. You will be coming every like alternate Sunday, and this is a way like to build to contribute to the community and to help the women in GCC very particularly. And this is not but like constricted to this particular geography, but it is open to all women who are hearing us. So
Yeah.
medically, Dr. Manjunath, what's the treatment for this
Yeah.
PCOS?
So medically, what we do is when they come, we try to put them on simple medicines. like metformin is the standard drug we use. Metformin, if you remember, or if some people may know, this metformin tablet is also used for a diabetic patient also. But here metformin is used not because they are diabetic already, just to control the, as I told, the insulin metabolism is also altered here. So that's why we
Mhm.
use metformin. And if their cycles are irregular, we use contraceptive pills, or we call it as estrogen pills. But please remember, the whenever you use this hormonal pills therapy, you choose a pills which has lowest estrogen content. So I think
Okay.
most of the gynecologists know, when we are treating the PCOS, we should use the hormonal pills which has lowest estrogen content. So that
Mhm.
will regularize the cycles also, and it will not have a long term. These kind of hormonal pills can be used for years, like 4 years, 5 years also. Even if you use for 4 or 5 years, when we use a lowest estrogen tablet pills, it will not have a long term complications because of the pills. So that is one thing. And weight reduction, as I told, in the lifestyle modification we need to do, but we can take the help of some medicines to reduce the weights also. Nowadays, the fashion drug, you might have all know that Ozempic revolution is happening. Uh, um, those are all called semaglutide injections. Basically, they are
Okay, that
GLP.
Munjaro regime, is it?
Manjaro. So they are basically GLP-1 inhibitors, we call it as. So we
Mhm.
can use, but again, there are no long-term studies in that. There are now, nowadays, they are telling that there are some kind of mental disturbances if you use that drug for a long-term period. So maybe we need to consult the physician before you start the drug, analyze it, and then start using it. Don't use on your own. That is the thing. And the few other, if they are not ovulating properly for our consumption, we use certain kind of hormonal pills called Letrose, GnRH, HMG, FSH injections to make them ovulate. So these are all the few drugs we use to treat the PCOS conditions, Dr. Nahid.
Yeah, thank you so much. And consulting a professional always is like the nowadays a big mistake people are doing is they just consult their friends and their the WhatsApp university. So and they
Correct.
go by that. So that is a very
Yeah.
big in this awareness campaign. This is where I want people to come out to reach out to professionals like you and follow you, and here there is an opportunity to ask you any question. So what is the complication of PCOD, PCOS, as you say?
The complications of PCOS is, Dr. Nahid,
Yeah, long
usually
term. Yeah,
majority of,
like.
yeah, majority of the PCOS will not have any long-term complications, but maybe 20% of the PCOS will have complications. One, the complication is they are increased risk of endometrial cancer, we say. So that's why those ladies who have PCOS above 35, 40 years, every 2 years or 3 years, they should have one checkup, either by scanning or some kind of screening procedure. They should have a checkup, because these ladies are means increased risk of developing endometrial cancers. The second complication is, they after they cross around 45, 50 years, they may have cardiopulmonary complications, like maybe increased cholesterol, which is blocking the cardiac vessels, and it can result in cardiac arrest, obesity and obesity related complications, bone weaknesses. All this will, long term complications usually seen after 45, 50 years, not in the reproductive age. So usually
Okay.
all after 45, 50 years. That's why the PCOS ladies should be monitored once they cross around 45 years. Every 2 years, 3 years, we need to have a regular screening for all these endometrial cancer, cardiac problems, the obesity related problems, cholesterol problems, those and any bone weaknesses. These are all the problems they can have. So we should look for these kind of complications when they cross around 40, 45 years.
Dr. Manjunath, what are the combinations of PCOS? Like I
Yeah.
I I
So
was reading
combination of
somewhere, so I can. Yes, over to you. Can you please explain
so the
this?
combination of Yeah, combination of PCO, as I was telling, PCOD and the PCOS. PCOD is a mild form of PCOS where there is only disturbance in the cycles and the ovulation will not happen. So basically, it will affect only the fertility part. So that is
Hmm.
called PCOD. But if it's a PCOS, it's a severe form where the entire metabolism is disturbed, and it can lead to all kind of cholesterol increase, insulin increase, complete endocrine hormone get disturbed, and it can affect all the gut bacteria. It can affect cardiac, kidney, all those kind of things. So that's a severe form where it is called as PCOS. PCOD is a simple where there is be irregular cycles and there will be difficulty in ovulation. Means the egg production there will be a problem. So that is the difference between PCOD and the PCOS. So the combination, as I told you, right, there will be hyperinsulinemia, hyperandrogenism, irregular cycles, obesity. These are all the combination. Means there will be some people, even they need not be obese, but they will may have a PCOS. People have that this thing that only obese people will have PCOD. No, there are at least 20% of the PCO, 30% of the PCO who are lean PCO. Lean PCO means the weight will be under control, but they will have a
Okay.
PCOS. So those are all the combinations of PCOS.
My last question to you, that is it fine in PCOS to have cycles at long intervals?
No, no, that's what some PCOS will come with they are not getting periods for 6 months, 1 year also. Only they get tab pills, then only they will get periods. Otherwise, if you leave like that, they will not have periods for 6 months, 1 year. That should not happen because the more the longer the duration of not having periods, more the chance of developing long term complications, especially the endometrial cancer, the uterine cancer. So make sure that in a year at least 5 to 6 periods are there, means at least once in 2 months they should get periods. It should not live for 6 months to 8 months like that. They should not live without having a periods. So this is very important because periodically the uterus lining should shed once in 2 months at least. It should shed. So in a year 5 to 6 cycles is a must. So some people will have they will ignore that and they will not have periods for 8 once in 8 months, 9 months they will have only, even only after taking the pills they will have periods. That should not be done. So make sure that once in 2 months you have a periods.
Yeah. Thank you so much for being here. And you are one of our impaneled one person. So professionally, you can contribute to our community. So I'm really thankful on the behalf of every woman in my community, and hopefully, like I'll have more set of questions and people coming in and asking you more questions and taking the advantage of your experience. So I'm sensing you are traveling. So 19th of April. I don't know whether you are
Yeah,
in India or you'll be back. So hopefully your
I will
schedule,
get back, Dr.
you'll be back. You'll be back, right? So
Yeah, yeah.
19th 19th 2 p.m. GST is our time to have you again. And in between, if we are happy for our community people to reach out to you. So thank you so much for being here and helping us. See you again. You can say a last some message to the community for them to come, and like anything you want to share with them, just the last message for in today's
Uh,
podcast.
Yeah, thank you, Dr. Nahid Khan, for having me here in your podcast. It's really, I enjoyed thoroughly because I love to educate people because I feel without awareness, people will simply suffer. That should not happen. whether they suffer emotionally, physically, they should not have. When they have a complete awareness, a scientific knowledge should make them escape from this unnecessary turmoil they go through it. So that's my intention. Again, coming particularly to the PCOS, PCOS is not a great danger to the life or anything. But once the PCOS is there, we should have little precaution, little alter in our lifestyle. So if they take care of that, if they take their health into their hand, so they can lead a healthy, peaceful life. That's all I want to say. Thank you so much once again, Dr. Nahid, for having me here.
And, and thank you to the people who are watching this podcast. Do comment so that we also know how we can really contribute to you and really help you, support you, assist you. So thanks to everyone who is watching this. Thank you.